Anemia. Anemia is a condition in which there is a deficiency of hemoglobin in the blood. There are different types of anemia with various underlying causes. Iron deficiency anemia is the commonest form of anemia. Red blood cells carry hemoglobin, an iron-rich protein that attaches to oxygen in the lungs and carries it to tissues throughout the body. Anemia occurs when you do not have enough red blood cells or when your red blood cells do not function properly. It is diagnosed when a blood test shows a hemoglobin value of less than 13.5 grams/dl in a man or less than 12.0 grams/dl in a woman. Normal values for children vary with age. What red blood cells do? Your body makes three types of blood cells: white blood cells to fight infection. Platelets help your blood to clot. Red blood cells carry oxygen from your lungs to the rest of your body and carbon dioxide from the body back to the lungs. Red blood cells contain hemoglobin, an iron-rich proteins that give blood its red color. Hemoglobin enables red blood cells to carry oxygen from your lungs to all parts of your body and to carry carbon dioxide from other parts of the body to your lungs to be exhaled. Most blood cells, including red blood cells, are produced regularly in your bone marrow, a spongy material found within the cavities of many of your large bones. To produce hemoglobin and red blood cells, your body needs iron, vitamin B12, folate and other nutrients from the foods you eat. When you have anemia, your body lacks oxygen, so you may experience one or more of the following symptoms: weakness, shortness of breath, dizziness, fast or irregular heartbeat, pounding or whooshing in your ears, headache, cold hands or feet, pale or yellow skin, chest pain. A doctor may also note signs such as angular stomatitis. It is the inflammation and cracking of the mucosa at the side of the mouth. Other signs include glossitis, sore tongue, atrophic gastritis, blood loss, koilonychias, brittle, spoon-shaped nails, brittle hair, pallor of the skin. In older patients, swelling of the ankles and chest pain occur. Pernicious anemia is due to vitamin B12 and folic acid deficiency. Symptoms include a sore, smooth and inflamed tongue, diarrhea and tingling fingers and toes. Patients with severe anemia may have a typical lemon tint to the face. Patients with sickle cell anemia may experience a painful chest, abdomen, girdle syndrome, spleen or bones. Leg ulceration may occur and rarely hemiplegia, paralysis of one side of the body, and convulsions. Kidney damage may occur. The patient will be feverish and feel weak. Am I at risk for anemia? Many people are at risk for anemia because of poor diet, intestinal disorders, chronic diseases, infections, and other conditions. Women who are menstruating or pregnant and people with chronic medical conditions are most at risk for this disease. Risk factors. The risk of anemia increases as people grow older. If you have any of the following chronic conditions, you might be at greater risk for developing anemia: rheumatoid arthritis or other autoimmune disease, kidney disease, cancer, liver disease, thyroid disease, inflammatory bowel disease, Crohn's disease or ulcerative colitis. The signs and symptoms of anemia can easily be overlooked. In fact, many people do not even realize that they have anemia until it is identified in a blood test. Common types of anemia. Iron deficiency anemia is the most common type of anemia. It happens when you do not have enough iron in your body. Iron deficiency is usually due to blood loss but may occasionally be due to poor absorption of iron. Pregnancy and childbirth consume a great deal of iron and thus can result in pregnancy-related anemia. People who have had gastric bypass surgery for weight loss or other reasons may also be iron deficient due to poor absorption. Vitamin deficiency anemia may result from low levels of vitamin B12 or folate, folic acid, usually due to poor dietary intake. Pernicious anemia is a condition in which vitamin B12 cannot be absorbed in the gastrointestinal tract. Anemia during pregnancy. Aplastic anemia is a rare bone marrow failure disorder in which the bone marrow stops making enough blood cells, red blood cells, white blood cells, and platelets. This occurs as a result of destruction or deficiency of blood-forming stem cells in your bone marrow, in particular when the body's own immune system attacks the stem cells. However, the few blood cells the marrow does make are normal. Viral infections, ionizing radiation, and exposure to toxic chemicals or drugs can also result in aplastic anemia. Hemolytic anemia occurs when red blood cells are broken up in the bloodstream or in the spleen. Hemolytic anemia may be due to mechanical causes, leaky heart valves or aneurysms, infections, autoimmune disorders, or congenital abnormalities in the red blood cell. Inherited abnormalities may affect the hemoglobin or the red blood cell structure or function. Examples of inherited hemolytic anemias include some types of thalassemia and low levels of enzymes such as glucose 6-phosphate dehydrogenase deficiency. The treatment will depend on the cause. Sickle cell anemia is an inherited hemolytic anemia in which the hemoglobin protein is abnormal. It causes the red blood cells to be rigid and clog the circulation because they are unable to flow through small blood vessels. Anemia caused by other diseases. Some diseases can affect the body's ability to make red blood cells. For example, some patients with kidney disease develop anemia because the kidneys are not making enough of the hormone erythropoietin. Erythropoietin signals the bone marrow to make new or more red blood cells. Chemotherapy used to treat various cancers often impairs the body's ability to make new red blood cells, and anemia often results from this treatment. What causes anemia? The most common cause of anemia is low levels of iron in the body. This type of anemia is called iron deficiency anemia. Your body needs a certain amount of iron to make hemoglobin, the substance that moves oxygen throughout your body. However, iron deficiency anemia is just one type. Other types are caused by diets lacking in vitamin B12, or you can't use or absorb vitamin B12, like pernicious anemia. Diets lacking in folic acid, also called folate, or your body can't use folic acid correctly, like folate deficiency anemia. Inherited blood disorders, like sickle cell anemia or thalassemia. Conditions that cause red blood cells to break down too fast, like hemolytic anemia. Chronic conditions causing your body to not have enough hormones to create red blood cells. These include hyperthyroidism, hypothyroidism, advanced kidney disease, lupus and other long-term diseases. Blood loss related to other conditions such as ulcers, hemorrhoids or gastritis. What causes iron deficiency anemia? You can get iron deficiency anemia from bleeding, either from losing a large amount of blood quickly, for instance, in a serious accident, or losing small amounts of blood over a long period of time. The body loses more iron with blood loss than it is able to replace with food. This can happen to women having heavy menstrual periods or in people who have inflammatory bowel disease. Not getting enough iron in the diet. Needing more iron than you did previously, for instance, during pregnancy or illness. Some types of iron deficiency anemia are called by other names related to the cause, such as anemia of chronic disease, also called anemia of inflammation, or acute blood loss anemia. What causes types of anemia that aren't iron deficiency anemia? Pernicious anemia. In a strict sense, pernicious anemia happens when a person lacks something called intrinsic factor, which lets them absorb vitamin B12. Without vitamin B12, the body cannot develop healthy red blood cells. Other types of anemia that involve lack of B vitamins, such as B9, folic acid, are also often lumped in as pernicious anemia. This name may refer to other conditions, including folic acid deficiency anemia and Addison's anemia, even though there is no intrinsic factor deficiency. Hemolytic anemia. This type of anemia can be caused by inherited or acquired diseases that cause the body to make deformed red blood cells that die off too quickly. An acquired disease is one that you didn't have when you were born. If it is not genetic, hemolytic anemia can be caused by harmful substances or reactions to certain drugs. Sickle cell anemia. This genetic form of anemia happens because the shape of the red blood cells is faulty. They are sickle-shaped, which means that they can clog the blood vessels and cause damage. The hemoglobin does not work correctly. This type of anemia is most often, but not always, found in African Americans. Diamond-blackfan anemia. This is a rare blood disorder that may be inherited or acquired. In this type of anemia, the bone marrow does not make enough red blood cells. Diamond-blackfan anemia is diagnosed within the first year of life in nearly 90% of people who have it. Aplastic anemia. This is a type of anemia and that is caused by damaged bone marrow which is unable to make enough red blood cells. It also may be congenital or acquired. Another name for aplastic anemia is bone marrow aplasia, failure. Some people might think of this condition as cancer, but it is not. There is something referred to by some people as myelodysplastic anemia. However, myelodysplastic syndromes, MDS, refer to actual cancer and are a result of abnormal cells in the bone marrow. Fanconi anemia. This type of anemia is also rare and it is genetic. It happens because the bone marrow does not make enough red blood cells. There are physical signs of this condition, such as abnormal bone structure and abnormal skin color. About 50% of people with this condition are diagnosed by the time that they turn 10 years old. Mediterranean anemia. This condition is also known as Cooley's anemia and actually refers to beta thalassemia major. Thalassemias are inherited conditions in which your body does not make the right amount of hemoglobin. In addition to not making enough of these cells, the red blood cells do not live as long as they would in someone without the condition. Vegetarian or vegan anemia. This term refers to the idea that people who are vegetarians or vegans have a difficult time getting enough iron because they don't eat meat, poultry or seafood. However, careful food planning makes this statement false. There are plenty of ways to get enough iron with a plant-based diet. Your doctor might also use terms for anemia that refer to the size of the red blood cells. These words include terms like macrocytic anemia, larger than normal cells, or microcytic anemia, smaller than normal cells. Complications of anemia. Left untreated, anemia can cause many health problems, such as extreme fatigue. Severe anemia can make you so tired that you can't complete everyday tasks. Pregnancy complications. Pregnant women with folate deficiency anemia can be more likely to have complications, such as premature birth. Heart problems. Anemia can lead to a rapid or irregular heartbeat, arrhythmia. When you're anemic, your heart pumps more blood to make up for the lack of oxygen in the blood. This can lead to an enlarged heart or heart failure. Death. Some inherited anemias, such as sickle cell anemia, can lead to life-threatening complications. Losing a lot of blood quickly results in acute, severe anemia and can be fatal. Among older people, anemia is associated with an increased risk of death. Prevention of anemia. Many types of anemia can't be prevented, but you can avoid iron deficiency anemia and vitamin deficiency anemias by eating a diet that includes a variety of vitamins and minerals, including iron. Iron-rich foods include beef and other meats, beans, lentils, iron-fortified cereals, dark green leafy vegetables and dried fruit. Folate. This nutrient, and its synthetic form folic acid, can be found in fruits and fruit juices, dark green leafy vegetables, green peas, kidney beans, peanuts, and enriched grain products, such as bread, cereal, pasta and rice. Vitamin B12. Foods rich in vitamin B12 include meat, dairy products, and fortified cereal and soy products. Vitamin C. Foods rich in vitamin C include citrus fruits and juices, peppers, broccoli, tomatoes, melons and strawberries. These also help increase iron absorption. If you're concerned about getting enough vitamins and minerals from food, ask your doctor whether a multivitamin might help. Diagnosis of anemia. To diagnose anemia, your doctor is likely to ask you about your medical and family history, perform a physical exam, and run the following tests. Complete blood count, CBC. A CBC is used to count the number of blood cells in a sample of your blood. For anemia, your doctor will likely be interested in the levels of the red blood cells contained in your blood, hematocrit, and the hemoglobin in your blood. Healthy adult hematocrit values are generally between 38.3% and 48.6% for men and 35.5% and 44.9% for women. Healthy adult hemoglobin values are generally 13.2 to 16.6 grams per deciliter for men and 11.6 to 15 grams per deciliter for women. These values may differ slightly from one medical practice to another. Numbers might be lower for people who engage in intense physical activity, are pregnant or of older age. Smoking and being at high altitude might increase numbers. A test to determine the size and shape of your red blood cells. Some of your red blood cells might also be examined for unusual size, shape and color. Additional diagnostic tests. If you receive a diagnosis of anemia, your doctor might order other tests to determine the cause. Occasionally, it can be necessary to study a sample of your bone marrow to diagnose anemia. How is anemia treated? First, your doctor will find out if the anemia is being caused by a poor diet or a more serious health problem. Then, you can be treated for both the anemia and its cause. Iron deficiency anemia is treated with iron supplements taken by mouth, foods high in iron and foods that help your body absorb iron, like foods with vitamin C. Iron given through an intravenous, 4, infusion. This is often a choice if you have chronic kidney disease, or CKD. Transfusions of red blood cells. If your anemia is caused by internal bleeding, your provider may need to do surgery to stop it. Surgical repair has been used to cure anemia in people with the paraesophageal type of hiatal hernias, with or without ulcers, called Cameron's ulcers. Other types of anemia may require other types of treatment. For instance, genetic disorders, like beta thalassemia and sickle cell anemia, may require bone marrow transplant. If CKD is causing your anemia, in addition to iron supplementation, through oral or 4 means, treatment could also include injections of erythropoietin, EPO. EPO is a hormone that tells the bone marrow to make red blood cells. Anemia is also linked to cancer in some cases, both in terms of anemia being a symptom and in terms of cancer treatment. Both radiation and chemotherapy can cause anemia. It might be necessary to stall further cancer treatment until the anemia is improved. It is improved by iron, blood transfusions, getting necessary B vitamins and/or getting shots of drugs to stimulate your body to produce EPO. Approximately 5 to 600 million people are affected by iron deficiency anemia worldwide. It is most common in menstruating women. In the UK, 25% of the West African population and 10% of the Afro-Caribbean have sickle cell trait. It affects both the sexes equally. Pernicious anemia accounts for 25 new cases per 100,000 people over 40 years of age. It is more common in women and affects all racial groups. The average age of patient is 60 years. Any patient not of Northern European descent requiring anesthesia should be screened for sickle cells beforehand. Anoxia, lack of oxygen in the tissues, must be avoided in order to prevent a crisis. Antenatal screening is necessary for all sickle cell disorders.